Hello everyone, I am Kelsey Bolado from Group 3, reporting alongside with my group mate Cesar, Cyril, and Miguel. Together we will talk about antibacterial agents. As a recap from our previous discussion, what are antibacterial agents? These agents are derived from bacteria or molds or are synthesized de novo, that is, able to destroy or inhibit bacteria from growing and causing disease. Moreover, when a bacterial agent kills the bacteria, it is said to be called bactericidal. In contrast, when a bacterial agent inhibits or suppresses the growth of bacteria, it is said to be called bacteriostatic. So, our outline for my report would be some of the different kinds of antibacterial agents, such as sulfonamides, potentiated sulfonamides, nitrofurans, and sulfones. To start with, sulfonamides, which belongs to an important class of synthetic antimicrobial drugs. Sulfonamides are the first antimicrobial agents effective against pyogenic bacterial infections. These are most widely used antimicrobial agents in veterinary medicine, mainly because of their relative efficacy in some common bacterial diseases in animals and of low cost. All sulfonamides are derivatives of sulfanilamide or para-aminobenzene sulfonamide, which is the antibacterial component of an azodie or prontosil. In the chemical structure of sulfonamide, there is a sulfanilamide nitrogen designated as N1 and an amino nitrogen called N4. Most antibacterial sulfonamides have been synthesized by chemical substitution at N1 position. The individual members differ in the nature of N1 substitution, which governs the solubility, potency, and pharmacokinetic property of the compounds. A free amino group in N4 position is essential for antibacterial activity, and generally N4 substituted sulfonamides have reduced antibacterial activity. However, certain N4 substituted sulfonamides provide antibacterial action within the lumen of GI tract. They are white crystalline powders insoluble in water. Furthermore, sulfonamides have different classification based on clinical uses. There is a sulfonamides used for systemic infections, sulfonamides used to treat urinary tract infections, sulfonamides used to treat gut infections or gut active sulfonamides, and sulfonamides used topically. Moreover, in sulfonamides used for systemic infections, there is two types, the short acting and the long acting. The short acting are highly absorbed and rapidly excreted with a duration of action of 4 to 8 hours. Examples of drugs under these short acting sulfonamides include sulfathiazole, sulfamethazine, or sulfadimidine, sulfamerazine, sulfadiazine, and sulfapyridine. Meanwhile, in long-acting sulfonamides, they are highly absorbed but slowly eliminated, with duration of action of 1 to 3 days, because of high protein binding or lipid solubility, which are reabsorbed in renal tubules. Examples of these are sulfamethoxypyridazine, sulfaethoxypyridazine, sulfademethoxine, and sulfachloropyridazine. In sulfonamides used to treat urinary tract infections, these include sulfasoxazole or sulfafurazole and sulfisomidine. These are highly water soluble, rapidly excreted via urine, mostly unchanged, undergo least acetylation or acetylated crystals that are highly soluble even in acid urine. So they are less propensity to cause crystalluria and attain high concentration in urinary tract. So, unlike sulfonamides used to treat urinary tract infections, sulfonamides used to treat gut infections or gut active sulfonamides. These are poorly soluble and are not absorbed from GIT. Such drugs include talisulfthiazole and succinylsulfathiazole. are inactive as such and hydrolyzed in the GIT by intestinal microflora to phthalic and succinic acid and active sulfathiazole. In addition, sulfaguanidine or salicylazole-sulfapyridine or sulfasalazine is also hydrolyzed in a large intestine to sulfapyridine and aminosalicylic acid, which is an anti-inflammatory agent and is used in ulcerative colitis in dogs. Lastly, in sulfonamides used topically, it includes to treat eye infection and to treat burn and wound infections. Such agents include in treating eye infection is sulfacetamide sodium as 30% solution or 10% ointment. They are highly soluble and yield non-irritating neutral solution. In treating burn and wound infections, agents include mafenide or sulfamylon and silver sulfadiazine. In dosage of sulfonamides in animals, there includes the type of drugs and the drugs included and the administration of all species in milligrams per kilograms. In the types of sulfonamides, it includes systemic, enteric, and topical eye. Feel free to pause to read the drug's initial dose and the recommended maintenance for the type of drug. What is the mechanism of action of sulfonamides? Many bacteria synthesize their own folic acid, or which paminobenzoic acid, or PABA, is an essential constituent. Sulfonamides are structural analogs or competitive antagonists of PABA. They are competitive inhibitors of dihydroxytyrosine synthetase, a bacterial enzyme responsible for the union of PABA with pyridine residue in bacterial formation of dihydroxytyrosinic acid, which further conjugates with glutamic acid to produce dihydrofolic acid. Thereby, the antagonism leads to inhibition of synthesis of folic acid and subsequent metabolites, resulting in bacteriostatic effect. Furthermore, what are the principles that needed to be kept in mind when applying sulfonamide therapy? Know that sulfonamides should be administered as early as possible in the course of an infection, such as active growth or multiplication of bacteria, an active cellular and humoral defense mechanism, and prompt phagocytosis. In severe infection, larger dose should be given by parenteral route through intravascular or intramuscular. The initial large dose should be followed by regular smaller maintenance doses. Also, the plenty of water and urinary alkalizer such as sodium bicarbonate is to be given with sulfa drugs to prevent crystalluria. If there is any sign of anuria and hematuria, sulfa therapy should be stopped, and plenty of water and urinary alkalizer is to be given. Sulfonamides should not be given for more than 1 week because it may cause interference with normal flora and vitamin synthesis and cause development of drug resistance. If responses does not occur within 2 to 3 days, sulfonamide therapy should be stopped as no response could then be expected. As sulfonamides are bacteriostatics, their dosing should be continued for about 48 hours after the disappearance of clinical symptoms. Otherwise, there might be a relapse of infection or disease. Furthermore, the antagonists of sulfonamides include compounds containing PABA nucleus such as local anesthetics, which includes procaine, butane, and benzocaine, procainamide, and procaine penicillin. Note that sulfonamides are inhibitory of PABA, that's why compounds containing PABA nucleus are antagonists of sulfonamides. In continuation of antagonists of sulfonamides, such compounds also include or agents such as nicotinamide, folic acid, choline and their precursors, gelatin, albumin, peptone, and serum protein with which the sulfa drugs bind. Antibacterial action is neutralized in the presence of pus or tissue breakdown products that contain thymidine and purines, which are utilized by bacteria bypassing the need of folic acid. In contrast, what are the synergies of sulfonamides? It includes diaminopyrimidine or DAP derivatives like trimethoprim that act synergistically with sulfa drugs by inhibiting dihydrofolate reductase or the sequential blockade in PABA nucleic acid synthesis pathway. Meanwhile, in clinical uses of sulfonamides, sulfa drugs are used for the prevention and treatment of acute systemic and local in GI urinary tropical infections. The diseases cured by sulfonamides are actinobaciliosis, actinomycosis, strangles in horses, coccidiosis, mastitis, metritis, colibaciliosis, infectious polyarthritis, infectious keratitis, pneumonia, respiratory infections, urinary tract infections, pododermatitis, toxoplasmosis, meningitis, and foot rot. However, there are also adverse reactions of sulfonamide therapy when used improperly. Impairment of renal function is a common adverse reaction. In the renal toxicity, it is characterized by crystalluria, hematuria, and obstruction of renal tubules. The drugs crystallize in acid urine. Crystalluria is more common with rapidly excreted sulfonamides than those excreted slowly. The renal damage is also more common with their acetylated derivatives due to less solubility in acid urine as compared to their glucuronide or sulfate conjugates, which are highly soluble. The clinical signs of renal impairment include crystalluria, renal colic, repeated attempts to urinate, and elevated BUN levels. And crystalluria is more common in carnivores such as dog or cat, which excrete acid urine than in herbivora, which excrete alkaline or neutral urine. Adequate water intake and alkalinization of urine, such as sodium bicarbonate, thereby reduce the risk of crystalluria. Meanwhile, in toxicity of solnomides in acute reaction, they are rare but occurs when administered at high doses, particularly by intravascular route in dog, cat, calves, and swine. The acute toxicity signs include salivation, vomiting, diarrhea, excitement, hyperopnea, dyspnea, muscle weaknesses, ataxia, and rigidity or spasticity of limbs. Moreover, chronic adverse reactions include hematological alterations that are common, such as agranulocytosis, hemolytic anemia, reduction in cell counts and hemoglobin level, vesical hemorrhages, hepatic degeneration, cyanosis, jaundice, peripheral neuritis, such as sciatic and brachial nerves, and myelin degenerations such as spinal cord and peripheral nerves, which occur in dog and cat. Meanwhile, in poultry, they show drop in egg production, abnormal eggs, hepatic and renal insufficiency, anemia, agranulocytosis, and hypoprothrombinemia. Moving on in potentiated sulfonamides, these agents constitute the sulfonamides in combination with trimethoprim, which potentiates the antibacterial action of the former. Trimethoprim is an diaminopyrimidine derivative. The antibacterial spectrum of trimethoprim is similar to sulfonamides. In addition, also effective against some sulfonamide-resistant organisms like S. typhi, E. coli, Klebsiella, Haemophilus, and etc. It is a bacteriostatic drug and acts by selectively inhibiting bacterial dehydrofolate reductase enzyme. Its combination with sulfonamides results in potential of antibacterial action by sequential blockade, a two steps in bacterial folate metabolism and nucleic acid synthesis. Thus, trimethoprim resembling pyridine, moiety of folate, selectively blocks bacterial dehydrofolate reductase or DHFRase and produces bacteriostatic effect. Individually, both sulfonamide and trimethoprim are primarily bacteriostatic, but their combination is bactericidal. Trimethoprim has 50 times more or 50,000 times more inhibitory effect against bacterial DHFRase than against the mammalian enzyme. Therefore, it does not interfere with folate metabolism in mammals at antibacterial concentrations. Furthermore, in administration and dosage of potentiated sulfonamides, it includes sulfathiazine in combination with trimethoprim. It can be administered via parenteral, oral, or intrauterine bolus. In parenteral, a solution containing of 400 mg sulfadiazine and 80 mg trimethoprim at 1 to 5 ml per 30 kilograms once in a day. In oral, in the form of bolus containing 1 gm of sulfadiazine and zero point 0.2 gm of trimethoprim at 30 milligrams per kilogram once in a day, in the form of suspension containing 400 milligrams sulfadiazine and 80 milligrams of trimethoprim in 1 ml at 15 milligrams per kilograms for 5 days, as tablets containing 400 milligrams sulfadiazine and 80 milligrams trimethoprim at 15 milligrams per kilograms twice daily in dog and one and at 120 milligrams once daily in cats. Lastly, in intrauterine bolus, the cow and mare, the recommended is 2.4 to 4.8 gm, while in the sow and ewe is 1.2 to 2.4 gm. Meanwhile, in sulfadoxine in combination of trimethoprim, there is a parenteral route, which is a solution containing 200 milligrams sulfadoxine and 40 milligrams trimethoprim at 1 ml per 10 to 15 kilograms intravascular once in a day. Moving on in nitrofurans, these are a group of synthetic antibacterial compounds which contain a furan ring to which a nitro group is attached. The 5-nitro group is essential for their antibacterial action. They are broad-spectrum antibacterials effective against both gram-positive and gram-negative bacteria, but mainly used against gram-negative bacteria like E. coli, Salmonella, Klebsiella, and Bacteroid species, and also against Coccidia, Giardia, and Amoebae. The nitrofurans are bactericidal or bacteriostatic in action. Their exact mode of action is not known. They act by inhibiting the enzymes necessary for the carbohydrate metabolism of bacteria. They are also thought to be converted to some metabolites in bacterial cells, which interfere with the function of DNA. The antibacterial activity of nitrofurans is reduced in the presence of blood, pus, and milk. However, nitrofurans also has its adverse reactions. Toxic manifestation of these drugs include vomition, diarrhea, peripheral neuritis, allergy, and ocular disturbances. These drugs are not used systemically because of toxicity, but used for control of local or topical infections. In nitrofurans, such agents also includes nitrofurazone, which main indications include treatment of bovine mastitis, bovine metritis, and skin, burn and wound infections. It is also used as feed additive at 0.05% to control intestinal bacterial and coccigeal infections. Meanwhile, in nitrofurantoin, it is mainly used as an urinary antiseptic for the prevention and treatment of urinary tract infections, particularly in small animals. It is concentrated in acid urine, not precipitated, hence beneficial in dog at 4 to 5 milligrams per kilograms, orally thrice daily for 5 to 10 days. Also used in calves and horses at 10 milligram per kilogram per day, orally for 10 days. Meanwhile, in forazolidone, it has broad range of antimicrobial spectrum. It is effective against both gram-positive and gram-negative bacteria and Emeria and Histomonas spp. It is mainly used orally to treat enteric infections. Calves at 10 to 12 milligrams per kilograms orally twice a day for about a week. Meanwhile, in poultry at 0.04% in feed for 10 days. Lastly, in foralstadone, it is easily absorbed from GIT and has a medium antibacterial spectrum. It is used to treat bovine mastitis at 500 milligrams per quarter intramammarily, strangles in horses at 13 milligrams per kilograms IV for 5 days, and salmonellosis in chickens at 0.04% in drinking water. Other nitroforans agents include niforoquine, used in bacterial and Mycoplasma bovine mastitis, niforaldazone for control of bacterial enteritis in calves, and niforprazine, which is topically used in bacterial infections. Lastly, in my reporting, it includes the sulfones. Dapsone is the sulfone used as an antibacterial agent. It is chemically related to sulfonamides. It is effective against Mycobacterium leprae. Like sulfonamides, it inhibits folate synthesis in sensitive bacteria through PABA antagonism. Other anti-leprosy drugs are rifampicin and ethionamide, which is anti-TB drugs, clofazimine, and oil of Chalmugra hydnocarpus. So, for its clinical uses, sulfone is the drug of choice for treatment of leprosy in man. It is not commonly used in other bacterial diseases due to its potent toxicity. Adverse reactions include when sulfones are used improperly, such as its potent toxicity that which leads to hemolysis, methemoglobinemia, anorexia, nausea, and vomiting. So, furthermore, Cesar will further discuss the antibacterial agents specifically.